Hey, future doctors! Welcome back to our USMLE Step 1 Prep Series. Today we're exploring a case of a 24-year-old woman with hand weakness and muscle atrophy. Let's get started. A 24-year-old woman is brought to the physician 1 month after she was involved in a motor vehicle collision that left her weak and unable to walk. Physical examination shows weakness of both hands and atrophy of the intrinsic hand muscles bilaterally. There is weakness and increased muscle tone of the lower extremities on passive range of motion. Deep tendon reflexes are normal at the biceps and triceps bilaterally and are increased at the knees and ankles. Babinski sign is present bilaterally. Sensation to pinprick is absent at and below the level of the clavicles. The lesion in this patient is most likely located at which of the following spinal cord levels? Let's break down the key points in this patient's case. First, post-motor vehicle collision, she has weakness and inability to walk. Second, the physical exam reveals bilateral hand weakness and muscle atrophy, increased muscle tone in the lower extremities, increased deep tendon reflexes at the knees and ankles, bilateral Babinski sign, and absent sensation below the clavicles. This clinical picture suggests a spinal cord injury. Let's evaluate the options based on the level of injury. Option A, C5. A lesion at C5 would typically affect shoulder and arm muscles but not the intrinsic hand muscles. Option B, C7. A lesion at C7 could affect the triceps and possibly the hands, but the widespread symptoms and absence of sensation below the clavicles suggest a lower level. Option C, T1. This is the correct answer. A lesion at T1 can affect hand muscles and cause increased reflexes and muscle tone in the lower extremities, as well as absent sensation below the clavicles. Option D, T3. A lesion at T3 would affect sensation at a higher level, not just below the clavicles. Option E, T5. A lesion at T5 would affect areas lower than the clavicles and wouldn't account for the hand muscle atrophy. Therefore, the lesion in this patient is most likely located at the T1 spinal cord level. And that's how you tackle a USMLE Step 1 question on spinal cord injuries. Always consider the specific neurological findings and their correlation with spinal levels. If you found this video helpful, please like, subscribe, and hit the notification bell for more exam-crushing content. See you next time.